Hi, we're back. Yay. All right. Well, let's get on with Module 3, Lesson 2. This one's not going to be as long. We did talk about a lot of the concerns that we'll talk about in this module. Um, but I think that we need to reiterate it because it's very, very important. So let's get on with it. Yeah. And again, my disclaimer and disclosure, this course is not medical advice. It's education and information for you so that you can go to your own medical provider with this information, with the knowledge when you have those conversations about menopause. Okay. And again, I'm not getting paid by any drug or drug company or lab or imaging company. So, depression and anxiety there are higher rates of depression and anxiety in perimenopause and early postmenopause. So, from that whole period of time. And we'll talk a little bit about some of those factors. But it seems to be that the hormone changes may trigger these disorders to start for some women. For women who've already had issues with depression and anxiety, it may worsen. Not necessarily. You might be one of those people who is not going to have any issues, but it's really important to be aware. Right? A lot of people talk about being more anxious or irritable, and this is part of that. So mood disorders are often linked to the vasomotor symptoms and the hormone fluctuations. Think about if you ever had PMS symptoms. A lot of women, when they have PMS, feel moody or irritable during that time. So now that's a time where your hormones are also actually, that has to do more with progesterone levels dropping. So now in perimenopause, that estrogen levels staying a little higher, perimenopause is dropping, and then estrogen levels dropping, and that brings on those mood symptoms. So being linked to vasomotor symptoms, it just means those things are coming on at the same time. So when you have the night sweats, however, and we talked a lot about that, if you have night sweats, you're probably not sleeping very well. And if you're not sleeping very well, then that's going to make most girls crabby, right? So that could worsen in someone who already is having anxiety or depression. Then that sleep deprivation or insomnia could actually end up worsening those conditions or cause them to have a new onset. Oh, I had to pause for a sneeze. Okay, so what can you do? One of the things is to be aware, right? So to be aware you didn't get a good night's sleep, you haven't been sleeping well for, weeks at a time, and this is going to contribute to mood symptoms. Interestingly, one of the treatments for hot flashes and night sweats or one of the group of treatments is also a treatment for anxiety and depression. Paxil and Zoloft can be used to treat hot flashes and night sweats and can be used to treat anxiety and depression. So we all know that insomnia is very common in this time period. And we already talked about how it worsens your cognitive health and your physical health. And now this is the emphasis on the emotional health. And let me go back a second because I want to make sure that we reiterate that when you have this worsening of your emotional health, how that spirals into a worsening of relationships. So on the one hand, we can expect everyone around us to just put up with our behavior and our change and our lack of tolerance for their behavior, or we can do something about it and help us feel better so that we don't impact our relationships. Okay, sexual and reproductive health in midlife. So what they've found, let's say you get to menopause or late perimenopause, you're not going to get pregnant, right? So you may not be thinking you still need to use condoms if you're looking for new partners. You may be thinking, oh, I'm past the age of when I can get pregnant. And so that's why there's a rise in sexually transmitted diseases, because less condom use and people are meeting on dating apps and maybe they aren't getting to know each other well enough to make sure that they don't have a sexually transmitted disease. But if you're, old enough, I tell my kids this, if you're old enough to have sex, then you should also be old enough to have a conversation about the possibility of STDs and have that conversation with your potential partner. All right. So things that, stuff that I do for my patients and I want to do for you is really be thinking about whether you have depression, anxiety, or sleep disorders from related to menopause or even not related to menopause that you should be seeking care for. And care doesn't always mean that you have to go on a medication, or it doesn't necessarily mean you have to see a psychiatrist. Starting with just finding a counselor, and there's a lot of online counseling options now, so you don't have to go in person. I know that when you are feeling depressed or anxious, you're feeling overwhelmed, it can be hard to make the time to go and talk to someone, but that's what you need to do. And if it helps to find someone who's just going to be online, please do that. Okay. That counselor can then talk to you and advise you and say, oh, you know what? Yes, I think you should talk to your primary care doctor or even your OBGYN about potential medications, whether it's medication for anxiety or depression or medication for specifically for anxiety or depression or medication for menopausal, perimenopausal symptoms. That may just depend on what's going on with you. But don't hesitate to be reaching out because that's what those providers are for, whether it's a licensed mental health clinician, they call themselves different things, or a therapist. That's a great place to start, or your primary care doctor. And then if they think you need to see someone who just does mental health, they will let you know. I know it can be hard in a lot of areas to get in with a psychiatrist. So sometimes getting in with just a primary care doctor is the place to start. And there are a lot of now nurse practitioners who are trained in treatment of mental health specifically, like that's their specialty. So whatever you need to seek out to get that help. Again, going to your OBGYN, a lot of OBGYNs are very knowledgeable about mental health, or they may steer you in the right direction as well if they're not focused on the hormone treatment or mental health treatment, I should say, treatment of hormone symptoms. So, because as we spoke, the Paxil, Zoloft can be used to treat hot flashes and night sweats and treat anxiety or depression. Or if you were getting treatment for the night sweats with hormone therapy or with some of the newer medications we'll talk about later, that may then sort of lead to improvement in your mood. So don't let it continue though. Get help, please. And again, I do encourage using condoms or at least having the conversation before you're intimate with a new partner about whether they have a history of STDs, maybe getting tested, and using safe sex, using condoms if you're not sure, or if you want to wait and be with a person for a while, and make it a normal thing to talk about those things. Okay, so we did kind of a short talk this time about depression, anxiety during menopause, sleep disturbance, and how it plays a role in mental health, increase in STDs in menopause, and just overall thinking about the whole big picture, your mental health, your sleep, your relationships, they're all intertwined together. Okay, all right, see you for the next one.